Okay, welcome to podcast where we explore the intersection of technology, innovation, and the patient care. I'm your host, Dhrupal Patel, and today I'm thrilled to have with us Steve Bonner, CEO of SkinIO, a company that's redefining how we think about the skin health and the cancer prevention through AI and teledermatology. Steve, it's great to have you here. How your day so far?
Thank you, Paul. It's great to be with you. This will probably be the highlight of my day.
Good, awesome. So before we dive in, I always like to start with a bit of a personal lens, something beyond the professional bio. So who is Steve outside of the title and technology, where something people might not see when they read your LinkedIn bio or profile?
I'm a serial entrepreneur. I love innovation. I love healthcare. I also am very focused on the patient experience in healthcare and on finding good ideas and surrounding them with great talent. I also am the proud adoptive father of 8 horses, retired horses,
Wow,
who are living a beautiful life and have 6 children and 5 grandchildren. I just got back from a granddaughter wedding this
awesome.
weekend, so family is also right up at the top of the priority list.
Great to know that. Awesome. So let's jump into a few more details about your personal and then maybe we'll slowly move to the professional side. What do you think has shaped your perspective the most outside of work? Maybe a travel, a book, or a life experience that changed how you approach challenges nowadays?
That's a fascinating question, and a number of things pop into my mind. I did a kind of a deep look many years ago at what really comprises my mental view and drives me both intellectually and emotionally. And I discovered or brought forward what I probably already knew, and that is that I really do. I'm drawn to great ideas, and I'm a risk taker, but hopefully a thoughtful risk taker. I
Right.
also have a private Hall of Fame in
Hmm.
my head. I've identified the most influential people in my early life who really shaped me to be what I am and who I am. And now, 100 years later, all of that is still very present in how I look at myself and how I look at the world around me. I tend to be a workaholic. I get an idea
Hmm.
and that drives me and pulls me, and I can get out of balance with my life, but I've also learned to rebalance that over time. But I still, if I join you on something that is a great idea, you'll find enormous energy and almost limitless time to try to make a good idea better and help it help more people.
Awesome. I love to hear that. Means I see your energy and then amazing, like, from the beginning. So
Thank you. Thank you. Yep.
you led a company that all about health and prevention. How do you personally stay grounded and take care of your own well-being amid the chaos of running growing a tech company?
It's not easy. It's not intuitive to me, but I've learned a
Hmm.
lot. And so I program myself to have time for exercise, and especially I'm deeply devoted to Pilates. I have a great instructor and spend at least 4 hours a week one-on-one in studio with her. When I travel, she's on Zoom with me. And that is the cornerstone of making sure I'm moving and working on flexibility, especially as we get older and do desk jobs. The body naturally starts to limit you from a motion point of view. So that's the
Right.
key of it. And then I happen to live right in the middle of Chicago. I don't even own a car anymore. So I walk to a lot of things that I need to do to take care of what I need to take care of. And then I also love to play golf, so I program some of that into my life as well, which gets me outdoors and some balance into my life. And then mentally, I'm always thinking about SkinIO and the 30 million undiagnosed cancer patients who are walking around in the US, and thinking about how we can open up much better access to understanding their risk of skin cancer and to immediate care if they need it, which is a real breakthrough in dermatology.
Great to hear that. If you are not building a tech solution for skin health, what do you think that you would be doing right now? What an alternative path that you will always be curious about.
Well, I have in my private investment portfolio now 25 companies, different levels of involvement. I'm an investor in each, but in many I'm on the board, and some of them just pull me in more powerfully than some of the others. We've got an amazing company up in the Boston area that is completely reinventing the auto-injector technology. I spend time coaching and guiding them. It's very powerful. I've got a company in San Diego which has developed a new technology to help performers identify the brain patterns of people in their profession performing at an elite level. And then the technology helps to start to rewire their brains to emulate the performance of elite performers when they're in the zone.
Right.
That's another one. I've got a specialty company that's targeted to use mouse-based profiles and laboratory analyses to help connect every cancer patient in the US with the right chemotherapy the first time, every time. And it's a little bit like SkinIO. It takes the body out of the trial and error process and does it in a lab. And it's very unique and unusual. And so those are the kinds of things that I am spending some time on, but I would spend more time on if I weren't as involved in SkinIO.
I love that. It's clear that passion really connects to the mission behind SkinIO. So let's talk a bit about that journey, how the vision came to life. So for someone new to SkinIO, what is the simplest way to understand what you do and why it matters to them?
Wonderful. So help me think about the current state for skin cancer patients, and then let me explain some really pretty simple technology and process innovations that really create a full breakthrough opportunity for skin cancer patients. And as I mentioned before, there are roughly 30 million Americans living today with undiagnosed skin cancer. And we know that if you can find and treat skin cancer early, it's eminently curable, and it's very inexpensive to cure. The longer you wait, the more advanced it becomes, the more expensive and even life-threatening it becomes. There are only 10,000 practicing dermatologists in the US. People are living longer, they're more concerned about their skin issues, and so they're completely packing the pipeline into the clinics of dermatologists. And so the skin cancer worried patient who sees something, calls to get an appointment, is looking at 6 to 9 to 12 months just to get in for an initial visual exam. And the cancer isn't waiting for that. And so we have built is a app-based, at-home, full-body technological skin scan, skin exam. And you download our app. We're mostly B2B. We're developing a direct-to-consumer, but an authorized user downloads our app onto their iPhone or onto an iPad. They can do pure selfie mode. It's a little bit better if you have a friendly photographer. But the AI in the device guides you through capturing quality images of 13 different regions of your body.
Wow.
And it looks like facial recognition software. You download it, you get a white outline of head and neck. Then the AI starts talking to you, better lighting, better angle, farther, whatever. And as soon as it gets a quality image, the white turns green and it uploads the image into our database. And you do that 13 times, 10 minutes it takes. So you're already 6 to 9 months ahead of that initial observation. And then in the cloud, we have another application of AI that looks, well, first it computes the normal skin profile mathematically of each patient. And then it looks for statistically significant outliers from that. And so a scar or a freckle or a mole or a tattoo. Those are outliers, but they're not statistically significant when you're looking for skin cancer risk. So we find
Right.
anything that looks risky, technology highlights it, and then the full set of scans go to our panel of dermatologists, and one of them does a full review of all the scans, including any highlighted areas. And within 2 days of the 10-minute scan, the patient gets their report back from SkinIO. And it basically says one of three things. One, there's nothing here you need to be worried about right now. We've got your baseline scans, and in the future, every time we do another scan, it'll automatically compare with your previous ones. And number two, and that's about 2/3 of the people we scan, then about 20%, we say there's something here that'll benefit from a closer look, but it's not immediately of concern. When you see your doctor, take our scan and make sure they look at this and tell you what you think they've got. And then
Right.
5 to 10%, we say there's something here that needs to be seen in clinic immediately. And then we offer to get you into a clinic. We have 600 practicing dermatologists that work in our network and expanding every
Incredible.
day. And they promise to see one of our patients within 2 or at most 3 weeks. So in the conventional model, you're 6 months or more from initial exam. In our model, if you have high risk of skin cancer, you're in clinic for final diagnosis and treatment in 1 month.
Wow.
Accuracy of it is much higher. Stanford Dermatology did a study, said they think the visual exam might approach 80%. They said ours approaches 95% or is 95%. And actually, real world data, our largest customer that scanned 3,000 patients last year, said they think we perform at 99.5%. And then cost for the full service of what we offer is $239, whereas that first in-office 15-minute visual exam at 80% accuracy is $250 to $350. And also embedded in that cost is you had to take time off work, drive across town, sit in a waiting room for an hour. So the cost is even higher.
Right. Obviously, this is incredible. Means, I love the way that you explain the whole flow. So the one thing I found very fascinating about the SkinIO is how you are bringing screening access to more people, not just in clinics, but through the employer programs. What kind of response or adoption rate have you seen from that?
I think we have about 70 employer contracts right now, employers and unions.
Okay.
We also have a small presence in primary care clinics, which is a different model. But the adoption rates in companies have correlation to the size of the company. We get passionate small business owners who sign up and they scan all their employees. We get 100% and also make it available to families. United Airlines is our largest customer. We've scanned about 10% of their population now after 3 years.
Awesome.
And they said they didn't think we'd ever get beyond 3%, but we're up close to 10 and should go well beyond that with next year's program.
Wow. Okay, cool. Good to know. So when you think about the past year or two, what you have seen the biggest shift, either in how technology is being received by clinicians or how patients are engaging with digital skincare tools?
I think physician adoption of technology is a fairly laborious process. And there are a lot of good reasons for that, and not the least of which are that the whole system is depriving physicians more and more of the time they might use to explore new innovations. And we're pressuring them to see more patients in less time at lower cost. And so they get people coming to their front door every day. I've got the greatest solution you've ever seen. It'll transform your business. I just need 2 hours of your time to help you understand it and think about adopting it. And they say, go away. I don't have that kind of time. I'm just completely bound up. And so you're looking for the really unique participant. I think there's the early adopter and then across the chasm to full adoption kind of a model. And Generally, we're looking for the really innovative early adopter and trying to make it quick and easy for them. And we have some in the primary care world. All primary care doctors are talking to their patients who are worried about their skin, but they have no place to take them and no technology to offer. And so we put our technology in their office. It's a SaaS model in an office. And then the patient comes in for their annual exam. They do all their draws. They do their scans with us. They come back 2 days later and they've got the results of the scan. In addition, we've got connection to care. So the primary care doctors feel like they're adding real value to the lifelong quest of their patients. We have a nice little beginning of entry into that part of the market and are always looking for more. That's a good question. I don't see data on patient adoption and interaction with similar technology. We know generally that people are increasingly comfortable and increasingly frustrated by access to care. We know that every organization has pushed the patients into some sort of a front-end technological interaction. You call, you don't get a person, you go into a queue, the queue takes you in, you identify yourself as a patient, you can get your records, all those things, you can probably make an appointment and so on. So those kinds of things are certainly coming up the curve, but the acceleration of really meaningful me information and then connection to the care that I need, I just don't see data on that. I don't think there are many examples of that in the market. Okay. I don't know if you see any, Dhrupal.
I'm actually kind of fascinating with what you do, and by hearing that story with especially SkinIO, really amazing. Means I never came across that kind of any app so far. So now switching gears to more on the priorities and the challenges, right? When you think about next phase of SkinIO's journey, what is the most exciting to you right now?
Probably the most exciting is rolling out a real direct-to-consumer offering here. And another little data point is that 80% of the counties in the US have no resident dermatologist. You're in San Francisco in one of the outlying counties and there doesn't have to be a dermatologist, it's not a problem. But we have millions of people living in dermatology deserts where they're 2 to 3 hours away from a dermatologist. And the question is always, is there something I can see here that says I need to make that 4-hour round trip drive to see what's going on? And obviously, we can analyze and inform and then connect them and save them 4 hours in 90% of the cases and then get them to a place very quickly where the other 10% need to be in clinic. I think another big opportunity for us is helping the insurance companies understand that this is a different benefit with a different economic profile and a different outcome profile, and that they need to look at it differently than just the typical scanning product, which they have a real bias against.
Right.
And so we're, on the spectrum there. We've got Blue Cross of Illinois is completely committed to what we're doing, largely because one of their huge employers said, I want this for my people, and I want you to figure out a way to get it through the claim system. And so they did, and Blue Card members around the country can take advantage of that. A couple of the others, Aetna and Cigna, are close to that, again, being led by one of their big employers or more than one. Then we're just trying to start the conversation with United Healthcare. We have an FDA-related opportunity as well. We're currently FDA Class 1 registered, which we think is fine. We're not doing diagnosis. It's very low risk. We want to achieve a de novo status with prior approval Class 1, which will also dramatically accelerate the conversation with employers and with the insurance companies and with the government.
Great to hear that now you're approaching mostly all the major insurance company and their biggest employers. So they are covering amazing. What does winning look like for your team in next, I would say 12 to 18 months from now? Is it deeper partnership or new technology or new tech capabilities, new innovations within SkinIO, or a broader adoption rate?
Yes, 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 and yes. This is a multi-front skirmish we're in the middle of, and we need to continue to move forward on all of them. There are technology opportunities, especially smoothing this into the direct-to-consumer market, ensuring a very easy online experience for them. We
Mm-hmm.
also dream about possibly doing, rather than discrete regions of the body, just being able to do a video of the body and a much smoother, more convenient walk around or circle around the technology. Those kinds of things are exciting to us on the technological front. Certainly deeper penetration. We
Mm-hmm.
need to get to a tipping point in the market where everybody says, oh, SkinIO, I know what that is. It's not the usual. It's very valuable, and we want to have an opportunity to integrate that into our employees and then to
Mm-hmm.
the patients in the primary care and concierge setting.
And thank you so much for sharing that. So along those lines, to have a better trust and transparency, right? You have been leading an era where AI adoption is accelerating like anything, insane, but also scrutinized. How do you think about maintaining trust and transparency while innovating fast?
Secret to that is a combination of transparency
Mm-hmm.
and full integrity. We're not perfect. There are things that don't go well. We need to be very transparent with that. One of my favorite sayings is speak the truth fast. When we hit a speed bump, we need to confront it and share it with the people who are interested. Obviously, we're constantly trying to learn from what we've learned. So the machine learning part of what we do is also informing our design and enhancement activities. And we also try to hold ourselves very accountable for what it is we do. And we have a very sophisticated actuarial model that can help an employer at the beginning of the relationship put into the model their population skin cancer predictors, and then we can produce for them an expected 5-year ROI if they start spending money on our scanning technology. And generally,
Right.
they spend a little bit in the first year, and the second year, they turn positive in terms of savings from treatment costs, savings from off time work, savings from copays and deductibles. And the average
Exactly.
company should expect a 5 to 6 times return after 5 years on whatever they spend in our technology. And then if you have slightly higher incidence, our largest customer has a significantly higher incidence of skin cancer, so they're looking at a 20 times ROI. But I also think the people that are getting scanned early are the ones who know they're at greater
Mm-hmm.
risk. So there's a self-selection process that'll probably mitigate and come back down a little bit from that if we were to scan their total population.
And that's such an interesting point. And this is my equipment. I like this question a lot. So every organization or company has frictions, bottlenecks. And if you had a magic wand and you want to remove one friction point for SkinIO, what would it be?
It would be the insurance company support because it's so compelling for them, but they're just
Hmm.
not used to seeing this. And so you've
Right.
got to teach them a new way to think about looking at a benefit like this and evaluating it and the economics of it. And we're building a very robust database. I want more data coming back from the clinics that work with us so that we can
Okay.
see what the clinical diagnosis was compared to what we thought we saw, and then the care plan, the cost of care, and the outcomes. And having that kind of database will add a lot of credibility to our business model, care model, and success.
And that's true. We have been seeing a lot of evolvement dramatically over the past few years since pandemic using AI innovations in the healthcare. What advice or piece of advice you want to give to leaders building AI or digital health product today?
First, offer that ours is a very disciplined application of AI, and we're not generative
Right.
AI. We're working within mathematical,
Hmm.
formulaic AI applications. And to
Right.
be that kind of disciplined and controlled, but then to work very actively within that is very helpful to us. And so I think part of the challenge with AI broadly is that it's so broad.
Right.
And you can go out and you can literally acquire information that can push your mind in a bunch of different directions. And AI, the questions you ask it and the answers you get back are correlated with the value that you get. So trying to be as clear as possible, as disciplined as possible in the application of AI is important. And then for us,
Right.
connecting it to good machine learning so that within that lane that we create, we're continuing to see and hear what is really going on, what the patient experience is, what the technology is doing, and how can we continue to make ourselves better and better.
I 100% agree along those lines. Like a lot of people have a misconception on about AI in healthcare, and especially the healthcare ecosystem, where I think a lot of leaders or innovators I mean, that's what I always learned, that you need to use AI or implement AI very responsibly, right? Because there's a lot going on with AI, especially in the healthcare ecosystem. It should, better to be transparent. And since it's about all HIPAA, we need to be, I would say, responsibly adopt that. I think the my last question, if you could see the major breakthrough happen in the next few years in digital health, what would it be and why would it matter most to you?
For me, looking at digital health as a
Hmm.
technology issue is backwards. It's looking at digital health from the patient point of view.
Right,
So I would approach that from the point of view of what's healthcare navigation like for the patient, and how can we help each individual use technology to identify the things that really matter to them and that then they can easily access and implement. And part of that, a little bit like we're doing, is how much can we take off the backs of very busy
right,
practicing physicians and front it with great use of technology, convenient, accessible, accurate technology, but then that can link very quickly to the care that they
right.
need. And that's, there's a whole front end on navigating the normal healthcare system that needs to be rewired to
Hmm.
accommodate that. We've got these phone answering systems, and you got to go through each of the steps and get in, and you try to make an appointment and all that stuff. And they don't really know what your appointment need is, and you don't really know who you need it with, and so forth. There's got to be a much better way to help the system understand what's my situation, what do I need, and how can I connect immediately with that part of your organization and get quality, cost, speed, and outcomes all breakthrough with that kind of a view of technology in healthcare.
Awesome, awesome. Steve, has been a fascinating conversation, very much insightful. I love how you're bridging innovation and accessibility in the skin care or skin health. So for anyone who wants to learn more about SkinIO or follow your work or your company, where is the best place to connect with you online?
So my email address is steve@skinio.com. And I sit by my computer 24 by 7 by 365, hoping to hear from people who are interested. And my phone is 312-405-0748. Our website is www.skinio.com. So pick your channel and give us a chance to respond.
Thank you so much. And thanks again for joining us. And thanks to our listener for tuning conversation. I am Dhrupal Patel. We'll see you on the next episode. Signing off.
Okay, take care, Dhrupal.
Take care. Bye bye.